A couple of weeks ago, I had a bit of bad luck and had an accident on my scooter. As a result of that accident, I suffered injuries to my shoulder, my ribs, and my knee. Now, I was taken from the scene of the accident by ambulance to Stroger Hospital. Those of you who are from Chicago recognize Stroger as Cook County Hospital. You also recognize that Stroger is where you go under the following conditions. You have been shot, you have been stabbed, you don't have insurance, or you're like me and you don't have any control over being taken to Stroger. Put another way, the only folks who elect to go to Stroger are people who don't have insurance. Okay? I could not understand at the time why everyone was so concerned about whether or not I had lost consciousness. I'm being wheeled into the hospital and the doctor is leaning over me, or the nurse, whoever, and saying, well, did you lose consciousness? Asking the paramedic, well, did he lose consciousness? No, I didn't lose consciousness. I wiped out on my scooter. I'm really, really sore. They saw that I wasn't bleeding. They found out that I hadn't lost consciousness. They pushed me into a corner and they forgot about me for hours. I had road rash on my arm and my leg, still do. You think those cuts were cleaned or dressed? Absolutely not. I got an x-ray on my shoulder and my ribs. I was told I had a sprained shoulder, not a moderate sprain, not a severe sprain, not a mild, just a sprained shoulder, bruised ribs. I was complaining about my knee. They never even looked at my knee. They essentially told me, rub some dirt on it and you'll be okay. A couple of days passed, my ribs are killing me. I'm just like, you know what? I have to go and have somebody look at this. I've already been to Stroger. They can't tell me anything. I'm going to go to Northwestern Memorial Hospital. I get over there, I talk to the doctor, I get x-rays. I receive the following diagnosis: a sprained AC joint, a sprained medial collateral ligament, and rib contusions. Fortunately, the x-rays were negative for breaks or fractures. I was told, you know what? It's going to hurt you for some time. But I felt a lot better after I left Northwestern than I did after I left Stroger. Now, why was I able to go to Northwestern after having been at Stroger? Well, the answer should be obvious. It's because I have health care insurance. Why do I have health care insurance? Because I am fortunate enough to have a job. Well, what if I didn't have that job? And what if my COBRA expired? In other words, what if I didn't have health care insurance? That would mean that Stroger would have to be good enough. But Stroger is not good enough and should not be good enough for anybody. This is the United States of America, the world's wealthiest industrialized nation. And we have a de facto tiered healthcare system. Here is the insurance that you get if you have insurance, and here is the care that you get if you have healthcare insurance, and here is the care if you don't have any insurance, and this care is nothing. It's either that or you will spend the rest of your life paying for this care if it's a serious illness or injury. Now you think about that for just a minute. People, including me, have been conditioned to believe that in America we ought to be okay with not having insurance unless we're working, when there are 14 million people who are not working. And contrary to what Herman Cain seems to believe, we cannot just look in the mirror if we don't have a job and say, blame yourself if you don't have a job. That's not the way it works. There are millions of people who have given up looking for work because they cannot find a job, but they want desperately to work. And I would hazard to guess that of the 50 million people, 50 million people who don't have insurance, none of them woke up and decided, I'm good, I don't need insurance. I know that on the day of my accident, I didn't wake up and decide, today would be a great day to be in an accident. I know that when people are told that they have cancer that will require chemo, none of them woke up that morning expecting to hear that. No one wakes up expecting to be told that he or she is suffering from a chronic illness or disease. No one expects to leave home and come back months later on a stretcher because he will be paralyzed for the rest of his life. No one expects to be buried under a mountain of medical bills, but if you are a U.S. citizen, you have to move abroad to get universal health care because you do not have it here. Now, That is in stark contrast to the representatives and senators in Washington, D.C., who were sent there by the people to be advocates for the people. These men and women have the world's best health care, and they will have it long after they are out of office. They and their dependents have health care, and you don't. And you sent them there. You voted for these people, and you don't have it. So that would be like an employer not having insurance, but the employee having insurance. Tell me where outside of America that makes sense, and then tell me why it makes sense in America. I'll tell you how we can solve this, and it does need to be solved immediately. Because with all due respect to President Obama, and Lawrence O'Donnell has this absolutely right, the Affordable Care Act doesn't go far enough. We do need universal coverage. Here's how we can get it. We find the senators and we find the congressmen, we find the representatives who stood in the way of the Affordable Care Act. And we go to their districts and we go to their states and we ask their constituents, who among you lacks health care insurance? And as soon as somebody raises his hand, as soon as a woman raises her hand, we find that congressman, we find that senator, and we tell them, you know what? You don't have health care insurance. Your husband doesn't have health care insurance. Your wife doesn't have health care insurance. Your children and any other dependents don't have health care insurance until these constituents who sent you here have health care insurance. These people don't have the benefit of the pharmaceutical lobby and the health care lobby tripping over themselves to give them money to vote against them having health care insurance. And this is an absolute joke that is not funny anymore. The Republicans and the Democrats in Washington who are worried about things such as the Defense of Marriage Act and whether or not a woman, we are going to go inside of a woman's uterus and tell her that she cannot abort a fetus. We're worried about that. But we're not worried about 50 million people who don't have insurance. We've got Mr. 999 himself talking about building an electric fence to keep aliens out. Who the hell would want to come here anyway? Who still wants to come to America? I mean, what are these people fighting for? Even their children who are U.S. citizens will not have universal health care. And these are the things that we're worried about. These are the things that the GOP 2012 field are worried about. And who are these people who keep sending these representatives and senators to Washington who are voting against their self-interests? 50 million people, I don't believe all of them are Democrats. I don't believe all of them are independents. I am sure, just as sure as I am looking into this camera right now, that some of them are Republicans. I cannot understand, I cannot begin to imagine the level of psychosis that would contribute to them voting for someone who is going to tell them that if you get sick, you're on your own. That's health care insurance? Don't get sick. That's the Republican health care plan? Don't get sick. But if you do get sick, you figure it out. You're on your own. Oh yeah, because we chose to get sick. I chose to have an accident. Listen, I am imploring everybody who is watching this right now, regardless of your political ideology, regardless of your party affiliation, Democratic, Republican, Independent, Green, Libertarian, this universal health care is the defining economic and moral issue of our time. Please contact your elected officials, your representatives, your senators, and tell them that affordable care does not go far enough. We absolutely need universal health care. The person who could end up needing that health care is you, regardless of what you believe, regardless of what you have been told. Think about that, if nothing else. This should not be about the law. This should be about humanity. And anybody who does not understand that, or does understand it and says we don't have the money to pay for it, is lying and inhuman. It's not that we can do better. We have to do better. Thank you.